that's what we're going to do. We're rounding up now. It's an easy screening tool in resource-challenged areas, and it makes use of 3 to 5% acetic acid to bag the cervix and visualize any precancerous lesions. It can be said to be positive or negative, inconclusive or suspicious. Next, please. Okay, it has a high sensitivity. They found out that it has a high sensitivity because I'm saying this because a lot of people will ask about a pap smear and say, okay, what is the difference? Well, they're both screening tests, let's put it that way, but this one is an instant result one. It's slightly more sensitive because when you say something is sensitive, that means you are likely to have more false positives than false negatives. A false positive means they may find you to be positive and you're not positive. Do you understand? There may be some things in the cervix that may just react to the agent and make you seem positive. But the benefit is that it's not a final test, so they'll still send you for something more for you to be sure whether you are positive or negative. You understand? But it's better than having a false negative where you're actually positive and it comes out that you are negative. So it has that benefit. It's simple, it's accurate, and it's also recommended by the American College of Obstetricians. Our own college hasn't written anything about it yet, so I can't give you the answer. All right, next, please. Next. Okay, one more thing we'll talk about before we go into the screening is the human papillomavirus vaccine. It is recommended for women from the age of 11 to 26. I'm sure people will shout 11, what are they doing? But the idea is, and then for men from the age of 13 to 22, the aim is to help prevent infection before much exposure. Yes. So it is not thought to be particularly useful for those above these age limits. It's not as if you cannot take it, but they're saying that the most effective time to take it is early, before one has the exposure. You can imagine a lady who's a very active young woman who has maybe 3 guys that she's going around with, and those guys, of course, will have their network of other guys. There's no amount of prevention that she's going to use. She's already inside it, you understand? So it's going to be less effective. So that's why they say if you have, preteen daughters and all that, you can, give the. It's the next, please. People ask about the duration of the vaccine. Research is still going on that, but as at now, they have not found it to diminish with time. It seems that it has at least long-lasting protection. The vaccines target certain HPV serotypes that cause cervical cancer, but not all the serotypes of human papillomavirus. So it is not 100% protective against the ones that it doesn't cover for. Is that clear? So in as much as it's a good preventive modality to adopt, it's not a 100% guarantee. So of course that means one should still be careful. This is a church. Usually the idea is it's supposed to be a one-man, one-wife situation all through life by the grace of God. So there shouldn't be such risks actually if you follow the way it's supposed to be. But it's not always like that. So they advise that people should be careful, because if you have the vaccine, the person can still develop an STI and still be predisposed to having cervical cancer. Next, please. Okay, so what I want you to take home is cervical cancer is one of those rare cancers with a known cause. It can be prevented. Early screening for all women can reduce the incidence to 0. A stitch in time saves 9. Thank you. Any questions, please? Or it was all clear? Any questions?
Yes, please, let me. Doctor, I'd like to ask you a question, please. One of my friends died about a few years ago. She did coil, and she didn't remember that she did coil. And the coil has been there for several years. And before she knows it, it has turned to cancer. Yes. Is it the real fact? Is it the coil? Can coil bring cancer? Leftover coil, can it bring cancer?
Number one, many of those coils can actually stay there for up to 10 years. They are made of inert material that is not supposed to react with the body or cause any harm.
Okay.
Presently, I do not know of any medical Don't be discouraged. And please, when you